tobacco is the major risk factor, and if this gets controlled, the attribution of almost over 30% cancers in India to tobacco, I think there will be some impact which I may create.
Right.
But I give credit to my mentors and my colleagues in tobacco control, and more importantly at the American Cancer Society, which made me transform from creating just the awareness about the tobacco control to the implementation part and implementation component program. And that is how I have chosen certain areas from time to time to work in tobacco control, which can work as case studies nationally or internationally and help people get empowered and get into a mode where they can help many others, hundreds and thousands, instead of my initial scenario and the argument which I had when I converted from being a surgeon to a public health person, that in public health you can have an impact on hundreds of people at the same time when you are talking about the person. And if you can empower people, I think that is where the credit lies for an individual, that if you can teach people do what you do, I think that is what makes the difference. So that is how I am practicing tobacco cessation as well. I do not practice so much as I train the people to practice tobacco cessation, because our burden of the country in tobacco is very high. Almost over 30 crore are current tobacco users. And if we see from that point of view, our primary goal should be, of course, reduce the burden of tobacco. Tobacco is also burdensome because it is causing almost 4,000 deaths daily due to tobacco-related illnesses. And just think of it, that if the people are not taking tobacco, that is all it is requires, to say no to tobacco or not to take it or quit it at an earliest. So our goal primarily is to reduce tobacco burden. Government has definitely strategized tobacco control. It is getting stronger day by day, but there are limitations to it. The approaches are prohibitory. The approaches require enforcement measures, and enforcement is so very difficult. So I consider that we are at a juncture again where what should we be doing, which is easy to do, at least for the health professionals. And I consider tobacco cessation is one area which everybody can practice into. It's not only for the doctors, it is for the nurses, it is for other healthcare workers. Anybody who has a commitment, who can communicate, and who has competence to deliver tobacco cessation can become a tobacco cessation specialist. That is how I see a specialist, that you are able to do something easily and for the masses. There are 3 actions, therefore, to be taken.
Doctor, can we have it on the slideshow, if you don't mind? Full screen?
Yeah, sure.
Thank you.
Is this better? So there are 3 actions to be taken. One is to avoid tobacco altogether. That is the best thing to do, to always say no to tobacco. The alternative is to go for tobacco treatment. Now, that is what we are going to discuss today. And once you have quitted tobacco, then adjust to tobacco-free life. So this is the third aspect that we need to do, or third action which requires to be taken. Everybody should remember this. Tobacco use is a disease and a tobacco user is a patient. Now, I'm not exaggerating, because the International Classification of Diseases does enlist tobacco use and nicotine addiction as the illnesses. In the International Code of Classification of the edition number 11, it is categorized as that. I'm not going to go into those details. The flaw that country has is that we are coding for all the diseases for which the patients come to the hospital. We are not coding our patients for tobacco use, for the tobacco-related illnesses, nicotine addiction, and that is where we precisely, therefore, do not know what is the burden of tobacco in the health services of the country. And that is where I think the challenge lies, because not many hospitals in private sector have tobacco cessation clinics, whereas my estimate is that in matching with the population of India, almost 25% adult patients are tobacco users. So almost 25% patients attending any hospital should be tobacco using, as it is in my hospital. So I think that is one bottom line that I think all participants should remember. Tobacco is pandemic, it's not an endemic. That also requires to be remembered, because we called COVID as a pandemic. But if COVID was pandemic with about 5 lakh deaths in 2 years time nearly, in India, almost 15 lakh deaths are occurring because of tobacco related illnesses every year. And in the world over, these are over 80 lakh deaths. So, and also one should remember the data that 10% of these deaths are due to passive smoking. But so it's good to call, I consider it's right time to call tobacco as a pandemic and not as an epidemic. I think there is a political maneuverability behind saying it an epidemic and not a pandemic, because you require more intense measures when you call it pandemic. Therefore, I emphatically say that because there is no safe tobacco product and also there is no safe level of its use, it is best to quit. For non-users, the best bet is to avoid it altogether. This is one sentinel study done internationally by two sirs by the British Empire Award, Sir Richard Peto and Sir Richard Dole. They did this study over a period of 50 years. They monitored 34,439 male British doctors who were smokers. They found that on an average, cigarette smokers die approximately 10 years younger than do the non-smokers. So there is a loss of life of nearly 10 years for the lifetime smokers. In India also, we have done a similar study, and we found that the loss of life is 6 to 8 years for smokers as well as smokeless tobacco users. And also one has to remember that not only the deaths occur early, it is important that those who continue to smoking, at least half of them will die due to tobacco related illnesses. These are two major impacts that we have to remember. And there is third aspect, which is here on the left side of the screen. And that says that if you quit, you can save the premature loss of life. Earlier you quit, there is a better preservation of the life. Almost total life you can have preserved, because if you are quitting in early age, then there is no origin of tobacco related illnesses as compared to the older age. But quitting helps regardless of the age. This is also an important message that one has to understand, that quit anytime. Even if you are 60 years, there will be some benefit. If the benefit is not going to be in the span of the life, it is going to help you in reduction of the intensity of the tobacco related illness. Or when you quit tobacco, the complexities which are occurring because of the disease in the patient reduces, the treatment becomes easy for the people. So there are ways to do it. One is the holistic approach, what we call as the Empower approach. Empower is a collective approach of tobacco control, which the WHO has devised. And this is a combination of the approaches which are required. O signifies in this Empower as offering to quit. The O in Empower earlier was thought to be an orphan, actually, because it was not attended properly until the last decade. But now we have started thinking that it's no more an orphan. But this can happen in the country if we consider that it's a responsibility on us to deliver tobacco cessation to every patient who is coming to us at every clinical encounter. I also take it as an opportunity, because there are not many things which you do and you feel satisfied that, okay, you have been able to do something which has helped a person to be risk-free, or to the risk to have been reduced for this person. So I think the O is very important from the holistic approach point of view. Now, for the individuals, I think it's very important that it is the nicotine in tobacco, which is responsible primarily for all that calamities that I am talking about until now. And it's very important to consider that, imagine if there's no tobacco in nicotine in tobacco, what will happen? Nicotine, which is an addictive substance, a psychostimulant, is responsible for the chronic relapsing condition that a tobacco user goes through. This is the pathway through which every user goes. Initially in childhood, one starts with exploration, as any child would explore the things, will find an adventure into it, and then he or she gets into experimentation with tobacco. becomes a weekend user, and then eventually it gets into the phase of habit. And one says that, okay, now it is habit, I can still quit anytime. But that habit, if you don't quit, it will get into addiction. The nicotine addiction is one of the worst addictions. It is considered a worst addiction to heroin and cocaine as well. And eventually, that's what is responsible for the disease and death of the people. Now, why people use tobacco? If somebody asks you, you can say, of course, that there is nicotine in tobacco, but you can also say that why people become addicted is because of the triggers, which keep multiplying. These are three triggers: persons with whom you take tobacco, the places where you take tobacco, and the times of the day when you take tobacco. These keeps multiplying. If you correlate with all these phases, you see that in exploration and adventure, one is taken once in a while in 30 days, a, a sort of bite of tobacco or a puff of cigarette or bidi. But thereafter, here in addiction, a person gets so much hooked to it that every hour he or she needs tobacco. So the triggers are very important from the tobacco cessation point of view. And let me tell you that the key in tobacco cessation success to help a person quit tobacco is primarily the elimination of triggers. If one can eliminate these triggers, the quitting can become successful.